Here with Dr. Leigh, dentist from South Hadley in Massachusetts. Is that right, Dr. Leigh?
That's correct, yes.
Good. Dr. Leigh, tell us a little bit about veneers and lumineers, the difference, what is the difference there? Because to us laymen, I don't know, I have not figured out what it is, and you see advertised lumineers on television all the time.
Yep.
So give us a little insight there.
Well, a lumineer is a type of veneer, and what the difference is that it's there's less preparation of the tooth, so it's a more conservative restoration. It's thinner, so we don't have to shave the tooth down as much as we normally would, and the results are just as good, if not better. And it's more comfortable for the patient because they may not need all those injections that we would normally have to give if we're doing a normal veneer or what's called a traditional veneer.
Right, so I see. So basically they literally are, the same thing, serve the same purpose, but one is, I guess, maybe more advanced because it can make it thinner. It would be an expression.
That's one way to put it. But with lumineers, there's, not everyone can do a lumineer, so it's really important to have a doctor that's capable of analyzing your bite and making sure that you're the right candidate, because you don't want to invest the time and money into doing a lumineer if it's going to end up breaking on you a year later. So the diagnosis is very important, and finding a qualified dentist is part of that. Is part of the process of determining if you're a right candidate for a lumineer. And if you're not, a lot of times there's other types of restorations we can do to improve your smile so that you can smile with confidence, and ultimately you want to be able to eat your food with confidence too, and not have to worry about if something's going to break in your mouth. So diagnosis is very important.
I see. So what you're saying here is that they're more or less, they have the same functions, but there are circumstances where the thin lumineer, where you don't have to grind the tooth down, which is a good thing, but where it just simply doesn't fit yet, it's not good for, and you need a veneer, which is the same thing, just a little thicker, and you might have to grind it after. But so the dentist is really the one making the decision here in most cases, not necessarily the patient saying, I want a Mercedes, or I want an Audi, or I want a Toyota. It's not quite that. All cars, they all serve the same purpose, and a customer can more or less decide. Here, it's not quite, so the dentist kind of say, well, I understand you don't want to grind your tooth and put a lumineer on it, but in your case, that's not a good thing, the cost, whatever that clinically might be.
Yeah, and sometimes the better option is to do Invisalign, so that you just may need to straighten your teeth or get them positioned properly, and then you can do a lumineer. So a lot of it depends on how your teeth are hitting each other, and if there's any grinding or clenching habits also. So we can consider a lot of things.
Right. Well, so you touched on something. So basically, tell us a little bit, veneers and lumineers, just to give us an overall picture what they're all used for, because you just said something. You want to straighten out your teeth with Invisalign, which is basically dental braces, but that doesn't do the trick for a chipped tooth or for a discolored tooth. So give us a little bit the reason of why one would, what can one fix with lumineer?
Sure.
Well, same thing. We're putting them in the same category now.
Yep. So like you said, a chipped tooth, or if the teeth are worn down, and basically what a veneer or a lumineer is it's a thin porcelain shell. Just like we veneer our furniture today. There's not a lot of solid wood furniture. A lot of it is particle board with a cherry oak veneer. So it's just a thin coating or a thin piece of wood covering that particle board. So with a veneer, it's a thin piece of porcelain that's placed on top of the tooth, and it's bonded or glued to the tooth, and that's where the strength comes from, the actual process of bonding the veneer to the tooth. And again, it's very thin. It's right. In the case of a lumineer,
what are we using it for? Let's just say I think I have two long rabbit teeth. Would you kind of grind them down and then put a veneer over it? Or let's just say I think I have two short teeth, or I have two narrow teeth, or I have two wide teeth, or what are we all using it for? What type of
I mean, all those examples. All those examples, short tooth, if the teeth are crooked, we can do a veneer. If there's spaces in between your teeth, we can veneer and close up those spaces. Again, chipping, wear, if the teeth are worn down, if they're really short, discolored, if they're dark, we can veneer them and cover them. Depending on how dark they are, you may need to do a traditional veneer, and the difference between doing that and Invisalign is it'll take 2 to 3 weeks as opposed to 1 to 2 years. So that really is the benefit of doing your veneers, is you can instantly change your smile in the matter of weeks.
I see. So basically, if you have overall crooked teeth, you have, in most cases, I assume, a couple choices. You do veneers or maybe crowns. Sometimes the veneer is basically in the front and the crown is all the way around. Sometimes the tooth is so badly damaged or whatever, you might need to just cover it in full. But the same principle still, relatively, right?
Well, yes, it's the same principle, and sometimes, and it's the same material also. It's just a different type of restoration, so it'll look the same. But again, you want something that's going to be strong enough and hold up, and that's why you would crown a tooth sometimes if the tooth is too badly broken down.
All right. So basically, it's just about all the time about cosmetic appearance. It's, I might wear a pink striped, or a lady might wear something striped because she's already a little heavy, so she wears something which doesn't make her even more heavy. Same with teeth. I guess you guys are very big artists. You adjust it so that it fits your facial structure, makes your face fuller, beautiful, and so. And that's where veneers come in. And sometimes a person might opt for not grinding anything down, but go for orthodontic work, which is in the new ways with Invisalign, which you can see is relatively acceptable, again, socially acceptable. You don't run around with this thick, heavy braces. Nobody wants to look at you.
Right, exactly, yeah.
Good. Well, all right. So let's leave it up to the dentist. Let's forget about the advertising kind of and say, I want Lumineers, because they might not, they might do the same purpose on a veneer, but you might simply need something else. So let the dentist decide, because just about every dentist is trained in both. He knows about both, and he knows what you need in terms of strengths and in terms of whatever it might be. Beautiful. Thank you very much.
Oh, sure. Great. You're welcome.